Welcome to 12 to Your Health. I'm Dr. Derek De Silva. Last week we talked about PRP therapy, or platelet-rich plasma. This week we're addressing how it's used to help athletes recover from various injuries. Joining us once again is Dr. Richard Braver. He's a podiatrist at Active Foot and Ankle Care in Englewood. Once again, thank you very much for joining us.
Oh, thank you.
Just very quickly, a recap. What is PRP?
PRP is a process where we take blood from the arm, put it in a test tube, put it in a centrifuge, spin it down, and take out the top layer, the plasma, and re-inject it into the injured area.
Now, I have heard that this therapy has been used with a lot of very famous athletes.
Correct.
Why are they opting for this therapy versus other therapies out there?
Because it speeds up the healing, and they don't have to miss the games like they might if they opt for surgery.
And what about this? What about recovery time? What about the procedure itself? Any risks, things like that?
Well, there's virtually very little recovery time. We actually take the plasma, inject it, which releases growth factors, which enhance healing. Sometimes we irritate the area with a needle to stimulate healing, but really it's very little risk. There's no chance of rejection. It's very holistic. It's your body's blood.
What are some of the how some of the athletes or some of your patients, have they benefited from this type of therapy?
Oh, tremendously, because they're able to go back to work that day. They're able to work being maybe they're a college athlete, a professional athlete. They go right back on the field. We may have to tape their ankle or, limit their activity level to a certain extent, but they're able to virtually compete right away.
Is PRP specifically for athletes? Is there an application for non-athletes also?
Absolutely, because we can take people that have had chronic injuries and convert them by irritating the soft tissues. We can irritate that, inject the PRP into that area, and it enhances the healing. Takes that old injury, makes it fresh, allowing the body to heal itself.
Why is that so important?
Because people have chronic injuries and they need to, if they have repetitive stress injuries, they can't work, they can't do sports, so this helps enhance the healing.
What I think people need to understand on this whole thing is that there's very little blood flow to tendon and ligaments. By stimulating the area and putting growth factors in there, is that the mechanism of how healing happens?
It's one of the methods. It's a major method because it creates an inflammatory response, and growth factors can actually recreate new blood vessels, recreate new collagen to enhance the healing.
Well, thank you very much for joining us. This is great information. This is a procedure that I've been very familiar with, that I actually have sent patients for, and I've had really, really good results with. So keep up the good work, and once again, thanks for joining us.
Thank you very much.
Pleasure. And folks, here's what we're looking up. Here's what we're looking at, what's coming up tomorrow. And remember, you can catch 12 to Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m. Well, it's time now for your Health Bite of the Week. Is there too much sodium in your diet? Well, more than 1,500 milligrams, or 2/3 of a teaspoon of salt a day, is considered excessive. Using dried herbs, spices, and juices from citrus fruits can help add flavor to your meals so you don't have to reach for the salt shaker. Well, I'm tackling another one of your common health questions today. What type of treatments are available for varicose veins? Well, one of the ones I really like is something called horse chestnut and butcher's broom. Those are some herbs that can be used for people with varicose veins. But the studies that have been done have compared compression stockings and varicose veins, and believe it or not, the two of them together have a tremendous effect. Thank you very much for joining us today. Here's a look at this week's Community Health Calendar.